In this video, we'll do an exam review on cerebrospinal fluid. We'll discuss its production, amount, secretions, and low and high CSF volume effects. Few important exam questions will get answers after the topic. Question number 1. How and where CSF is absorbed? Number 2. What's the pressure, amount, and production rate of CSF? And number 3. What are the features of low and high CSF volume headaches? Now let's discuss the cerebrospinal fluid. So where is it produced? 50% of the CSF is produced in the ependymal cells of the choroid plexus of the ventricles, and 50% is produced by the blood vessels around the ventricles. So 50% by the ependymal cells and 50% is produced by the blood vessel around the ventricles. Now CSF circulation. So what's the normal CSF volume? It's 100 to 200 ml and the production rate is 20 ml per hour. So 20 ml CSF is produced every hour and the total volume is about 100 to 200 ml. So how does it passes from the ventricles, or how does it passes out of the ventricles? The CSF exits from the fourth ventricle through the two foramen of Luschka and foramen of Magendie. Fourth ventricle has three foramen in it: cerebral of aqueduct, which connects it to the third ventricle. So the fluid formed from the lateral ventricle comes into the third ventricle through foramen of Monroe, and then from third ventricle through cerebral of aqueduct into the fourth ventricle, and then it goes into the subarachnoid space through foramen of Luschka. Laterally, they are two in number, and foramen of Magendie, which is one, into the subarachnoid space. Then the fluid circulates in the subarachnoid space and absorbed by diffusion and facilitated diffusion into the venous circulation through arachnoid granulation into the superior sagittal sinus. So it's produced by the ependymal cells and the blood vessel around the ventricle and is absorbed by the arachnoid granulation into the venous circulation into the superior sagittal sinus. Now composition of the CSF. Cerebrospinal fluid is almost similar to brain ECF and is produced from the blood by diffusion, facilitated diffusion, filtration, and active transport processes. And the pressure of the CSF is 10 millimeters of mercury, average being 7 to 15 millimeters of mercury. And if the CSF pressure is more than 20, then it is known as increased intracranial pressure. CSF osmolality is equal to the plasma osmolality. So CSF is similar to brain ECF and its osmolality is similar to plasma osmolality, but it has higher concentrations of magnesium, chloride, carbon dioxide, and cholesterol. So it's similar to plasma osmolality but has higher concentrations of magnesium, chloride, carbon dioxide, and cholesterol is 0.2 milligram per 100 ml in CSF, but cholesterol is 175 milligram per 100 ml in plasma. And bicarbonate is more in CSF than in blood plasma, but the pH of CSF is 7.33 and the pH of blood is 7.4. So compared to the pH of blood, pH of CSF is more acidic, although it has more bicarbonate. Why? Because CSF is in equilibrium with the venous rather than arterial plasma. So this pH of blood is the arterial pH 7.4, but the venous pH is acidic, so it coincides with the CSF pH. Now proteins are lower in CSF. They are 15 to 60 milligram per 100 ml, and glucose in the CSF is 2/3 of serum glucose, which is 50 to 80 milligram per 100 ml, and chloride is also higher than the serum, and there are no RBCs in the CSF. As I earlier mentioned, CSF pressure is on the average 7 to 15 millimeters of mercury, and more than 20 is increased intracranial pressure. If the CSF pressure falls, its absorption is decreased. Now, what are the results of decreased CSF absorption? Decreased CSF absorption through the arachnoid granulation, as occur in subarachnoid hemorrhage and other hemorrhages. Fluid accumulates in the subarachnoid space and increase in the CSF pressure, known as external or communicating hydrocephalus, that leads to increased intracranial pressure. So if there is decreased absorption through arachnoid granulation, that increases the CSF pressure, that leads to increased intracranial pressure. Also, CSF blockade through the foramen of Luschka and Magendie leads to accumulation of the CSF proximal to the block. Here it's Luschka and Magendie. If they are blocked, then it causes increased pressure proximal to the block. That increases CSF volume and increases the intracranial pressure in the ventricles. I just discussed about the connections of the different foramen. Foramen of Monro connects the lateral ventricles. These are the lateral ventricle, and this is the foramen of Monro that connects it to the third ventricle, and from the third ventricle through the cerebral aqueduct it's connected to the fourth ventricle, and the fourth ventricle is connected through the foramen of Luschka and foramen of Magendie to the spinal cord. So foramen of Luschka is on the lateral side of the fourth ventricle at the CPA, cerebropontine angle, and connects it to the subarachnoid space. Foramen of Magendie is the median foramen and opens in the midline and CSF from fourth ventricle into the subarachnoid space. So CSF exits through the foramen of Luschka laterally and from foramen of Magendie medially into the subarachnoid space. So there are 4 openings in the fourth ventricle: 2 lateral foramen of Luschka and 1 median foramen of Magendie, and 1 cerebral of aqueduct connects the fourth ventricle to the third ventricle. Now, what are the features of low CSF volume? Number 1, headache. In low CSF volume, the headache is more in sitting and standing position and less on reclining, because when person sits, fluid goes down, and this type of headache is absent on waking and worse during the day. In low CSF volume, pressure may be 0 to 50, but it may be higher up to 140 millimeter of mercury. So what are the causes of low CSF volume? Most common cause of low CSF volume is a CSF leak following a lumbar puncture, and this occurs in 10 to 30% of cases. Other causes of low CSF volume are epidural injection. Vigorous Valsalva maneuver may also cause low CSF because of leakage, and straining and coughing may also lead to it. Now, diagnosis of CSF leak, it's done by Spinal MRI and CT myelogram. And what's the treatment of the low CSF volume? Number 1, bed rest. Number 2, IV caffeine in 50 ml saline, and if this is unsuccessful, abdominal binders. And number 4, leaks can be stopped by a blood patch. So the treatment of the low CSF volume is bed rest, IV caffeine, abdominal binding, and a blood patch can also stop the leak. Now, high volume CSF headache that occurs on waking in the morning, improves as the day goes on. Fundi may be normal in high CSF volume, or there may be papilledema, and it also occurs in space occupying lesions and pseudotumor cerebri. So high CSF volume headache occurs on waking and improves as the day goes on. Fundi may be normal, or there may be papilledema. Now, the diagnosis of high CSF volume, it can be diagnosed by removal of CSF. That will improve the headache, and the treatment of high CSF volume is acetazolamide given twice daily, or topiramate, or number 3, carbonic anhydrase inhibitors. And weight loss also reduces high CSF volume headache. Now, answers to the questions. Number 1, how and where CSF is absorbed? CSF is absorbed by diffusion and facilitated diffusion in the venous circulation through arachnoid granulations into the superior sagittal sinus. Number 2, what's the pressure, amount, and production rate of CSF? Normal CSF volume is 100 to 200 ml, and its production rate is 20 ml per hour, and its normal pressure is 10 millimeters of mercury with an average of 7 to 15 millimeters of mercury. And if the pressure is more than 20 millimeters of mercury, then it's known as increased intracranial pressure. Now, what are the features of low and high CSF volume headache? The features of low CSF volume headache: it's caused by CSF leak following a lumbar puncture most commonly, and it's more in sitting and standing position and less on reclining, and it's absent on waking in the morning and worsens during the day. Now, the features of high CSF volume headache: this type of headache occurs on waking and improves as the day goes on. Fundi may be normal, or there may be papilledema.